Dental bridges are an extremely popular option for replacing teeth that are missing, as well as the process of healing following the procedure is a crucial element of the process that most patients do not comprehend. In this short video, we'll discuss the process of recovery is following the installation of a bridge and what you can anticipate in terms of discomfort, swelling, inflammation, and healing duration. It is crucial to know the definition of a dental bridge and the way it's put in place. Dental bridges are prosthetic devices that can be utilized to substitute the missing tooth or teeth. It is made up of a false tooth or teeth that are connected to crowns that are placed on both sides of the gap within the mouth. Crowns are typically put on natural teeth that are adjacent to the gap, or sometimes they are placed on dental implants. The procedure of obtaining the dental bridge usually requires several appointments with the dentist. In the initial visit, the dentist prepares the teeth for the abutment by taking out some enamel in order to allow room for crowns. The impressions of the teeth are taken and then sent to a dental laboratory, and the bridge will be made to the specifications of the mouth of the patient. While the bridge is being made, the bridge can be put in place to safeguard the teeth that are abutting it. When the bridge that is permanent completed, the patient can visit the dentist again for the fitting. The dentist will install the bridge and then make any adjustments needed to ensure a secure and natural fit. The bridge is then fixed with dental cement. Finally, the patient will receive directions on how to take care of the new bridge. When you receive a bridge for your teeth, it is common to feel some swelling and discomfort. The degree of discomfort and swelling may vary based on the person as well as the amount of dental work done. Certain patients might experience only some discomfort. Others might experience more severe discomfort that needs medication for pain. In order to manage swelling and pain following the installation of a dental bridge, you must adhere to the guidelines provided by the dentist. It could include using over-the-counter medications for pain, applying ice packs on the area affected, as well as avoiding food items that are hard or chewy and could cause irritation to the bridge. Also, it is important to maintain excellent oral hygiene, which includes cleaning and flossing frequently to avoid infection and encourage the healing process. Alongside swelling and pain, it is also normal to have patients experience sensitive teeth close to the bridge. The sensitivity could be temporary and will improve when the healing of the mouth. If it persists or gets worse, it's crucial to consult your dentist to get a second opinion. The time to recover after receiving dental bridges can differ dependent on the patient and complexity of the procedure. Most patients will be able to return to normal activity in a matter of days following receiving a bridge. It is nevertheless crucial to not chew on food items that are sticky or hard until the bridge has fully fixed and your mouth has been healed. The overall process of recovery following the installation of a dental bridge is fairly simple and easy to manage. If you follow the recommendations from your dentist and maintaining your dental health, you will be able to ensure an easy and smooth healing. If you are concerned or concerns about the healing procedure, don't be afraid to reach out to your dentist to seek advice and assistance.